Mr. President, I come to the floor today, as I have repeatedly since the health care bill was signed into law, to offer a doctor's second opinion about issues related to that health care law. And, Mr. President, a group of House and Senate Republican lawmakers, including Senator Thune of South Dakota, released a startling new report about the President's health care law. The report is entitled Class's Untold Story: Taxpayers, Employers, and States on the Hook for Flawed Entitlement Program. And I ask unanimous consent, Mr. President, to have this included as part of the record. Thank you, Mr. President. Many may remember that President Obama's health care law established a brand new federal long-term care entitlement program. It was called the CLASS program, a Community Living Assistance Services and Supports. Well, this CLASS program pays a stipend to individuals enrolled when they're unable to perform daily living activities, dressing, bathing, eating. And to qualify for the benefits, an individual would have to pay a monthly premium for 5 years, before the federal government starts to pay out any of the benefits. The health care law mandates that the CLASS program collects individual premiums for those 5 years before the program actually even starts to pay out benefits. Well, sounds pretty good, but not so fast. When it comes to the health care law, the American people have come to realize that if it sounds too good to be true, it probably is. The CLASS program was supposed to start January 1st of 2011, so about 10 months ago. But the Obama administration's officials decided to delay the program because they know it doesn't work. It's now known that the CLASS program was an intentionally designed budget gimmick. That's correct, an intentionally designed budget gimmick. During Senate floor debate of the President's health care bill, I, along with many other members on this side of the aisle, warned repeatedly that the CLASS program is a financial disaster waiting to happen. The Congressional Budget Office estimated that the CLASS program would reduce the deficit by $70 billion over a 10-year period. Well, these savings are mythical, and they come from the premium dollars that CLASS collects those first 5 years before it pays out a single penny. During those first 5 years, the program is not required to pay out any benefits to any individuals. Over its first 10 years, the Congressional Budget Office says that this CLASS program will collect $83 billion in premiums and only pay out $13 billion in benefits. But instead of holding on to the $70 billion in excess premiums collected to pay for future expenses that we know are coming, well, members of the Senate, members on the other side of the aisle, used those same funds to pay for the President Obama's health care law. And to add insult to injury, Washington Democrats then tried to claim that the $70 billion could also be used to pay down on the deficit. Well, the American people immediately saw that this claim was irresponsible. Even the Senate Budget Committee chairman, Senator Kent Conrad from North Dakota, admitted that the CLASS program was, quote, a Ponzi scheme of the first order, something he said Bernie Madoff would be proud of. Yet the President and Washington Democrats pushed to include this CLASS program in the health care law. This new report provides undeniable evidence that administration officials knew the CLASS program's design and payment structure were fiscally unsustainable. The Obama administration knew it, and yet they repeatedly ignored the explicit and persistent warnings. You may ask yourself, why is that? Well, the only logical explanation is that the administration officials chose to hide the CLASS program's true cost from congressional lawmakers and the American people, all to advance President Obama's ideological health care agenda. This push to advance an agenda rather than reasonable, patient-centered health care reforms served only to create yet another unsustainable entitlement program. an entitlement program that this country simply cannot afford. The Obama administration's chief actuary, a man named Richard Foster, he repeatedly tried to tell the administration officials that the class program was not fiscally sound. Internal emails from Mr. Foster first warned administration officials in May of 2009, well before the health care law was enacted. According to that report, this is what Mr. Foster's email says. He says, "The program is intended to be actuarial sound, but at first glance, this goal may be impossible." He said, due to the limited scope of the insurance coverage, the voluntary class plan would probably not attract many participants other than individuals who already meet the criteria to qualify as beneficiaries. He went on to say, while the 5-year vesting period would allow the fund to accumulate a modest level of assets, all such assets should be used just to meet benefit payments due in the first few months of the 6th year. And then a key sentence: the resulting substantial premium increases required to prevent fund exhaustion would likely reduce the number of participants, and a classic assessment spiral, or, he says, insurance death spiral would ensue. Well, what does this mean in plain English? It means that the class premiums will be too expensive to persuade young, healthy people to participate. It means that the class plan's long-term care payout is very enticing to people who know they're going to need the care. Healthy people don't participate. Sicker people do participate. Individuals in the health care system call the phenomenon adverse selection. When adverse selection occurs, then the American taxpayer is at very serious risk of being forced to bail out the program when it fails. The report goes on to show that Mr. Foster repeated his concerns during the summer of 2009. He writes to another administration official. He says, "I'm sorry to report that I remain very doubtful that this proposal is sustainable at the specified premium and benefit amounts." But he says, 36 years of actuarial experience lead me to believe, he said, that this program would collapse in short order and require significant federal subsidies to continue. Well, let me remind everyone that the chief actuary is a nonpartisan, high-ranking official at the U.S. Department of Health and Human Services. Chief actuary's estimates are critical to understand the health care law's true fiscal impact and long-term viability. Mr. Foster certainly doesn't have an axe to grind. He simply offered his analysis based on the data, and the Obama administration ignored him. Not only did Obama administration officials ignore Mr. Foster, they stopped requesting his input. But Mr. Foster wasn't alone. In the fall of 2009, the Department of Health and Human Services Office of the Assistant Secretary for Planning and Evaluation also raised the red flag. According to the report, one employee wrote in an email on October 22nd, quote, "Seems like a recipe for disaster to me." He said, "I can't imagine that class would not have high levels of adverse selection given the significantly higher premiums compared to similar policies in the private market." Mr. President, just a week after Senator Thune released this stunning new report on the floor of the Senate, media outlets indicated that the Department of Health and Human Services has closed its class program. Mr. Bob Yee, the class chief actuary, announced the closure in an email. He went on to say that he would leave his position at the class office actuary effective immediately. News reports indicated that the class office's employees have either been reassigned or asked to leave. Mysteriously, however, the Department of Health and Human Services issued a statement denying that the office was officially closing. In fact, the statement failed to say if and when the class program would even start. The Obama administration has had 18 months to figure out how to implement this class program. Recent developments show that they're not even close to resolving questions about the program's solvency. The American people deserve more. The American people deserve the truth. The evidence is indisputable. Administration officials at the Department of Health and Human Services knew that the class program was unsustainable. And they knew it before President Obama signed the health care bill into law. They knew it, yet this Senate and the House of Representatives and the administration failed in their duty to be honest with the American people and to tell them the truth. Were administration officials deliberately hiding Class's true cost for political gain? Well, this is certainly not the first time during the last several weeks that we have seen troubling reports exposing the administration's tendency to ignore financial warnings. They ignore the warnings so that they can advance politically important projects to them, projects that turn into expensive failures with the American taxpayers being stuck with the bill. I see this report, this incredible study, this report as yet one more piece of evidence that the President's health care law must be repealed. It must be repealed and replaced with reasonable, common sense, and financially sound alternatives. Patient-centered reforms that allow individuals to get the care they need from the doctor that they want at a price they can afford. Thank you, Mr. President. I yield the floor.